So my name is Dina Page. I am not a fan of exercise, but I am a fan of staying healthy. So if you integrate the exercises into your daily routine, then you can prevent further injury and stay fit. So just integrate them. If you're waiting for the pot to boil for your teapot or your coffee pot to perk, just stand at your kitchen counter and do some of these exercises, and it doesn't seem like such a chore if you do them every day during your regular routine. So when you're starting everything, you should be using a non-slip surface on your feet or on the floor. You should be using a sturdy chair or a heavy piece of equipment to hold on to, like a countertop. A high counter works well because you keep upright posture. The back of the chair is good, but you have to make sure it's not going to slip away. All the exercises should be done until you feel the burn. If you begin to feel pain at any time when you're doing them, then stop. You don't want to make injury worse, so if something starts to hurt, then just discontinue that particular item. If you want to add difficulty, then use your bottle of water. You can use a can of soup or just something light in your hand that fits so you're not going to drop. All these should be done daily. Twice daily is good. 10 to 15 reps as a beginner and 15 to 20 as you increase. Just make sure you're keeping track of the numbers that you're doing so that if it's easy, you can know that you can go to higher tomorrow, or if it's too hard and you hurt the next day, then you know that you've done too much. So make sure you're at least keeping track. Even if it's an odd number like 13, just keep track so that you know what you've done. And if it starts to hurt, the no pain, no gain theory doesn't stand nowadays. So if it hurts, it means you're hurting yourself. So just stop what you're doing. If the pain goes away, then I would say a mild discomfort is expected because you are trying to build new muscle tissue. But if it hurts after you stop doing the activity, then stop what you're doing. Okay, so if you have a mild leg, knee, hip, ankle injury, we can't do anything about the joint itself. So what we would do to prevent further injury is stable muscles around those joints. So any kind of core strengthening, or in these cases like the exercise we've done today, the exercises strengthen the muscles that cross the joints that may or may not be injured, so you're increasing your stability for future exercise. So you should do them until you feel that they're easy and continue on. Increase your reps and your frequency.